importance of the recovery position and how to assess a child's consciousness and breathing. Okay, in this episode, we're going to explore the importance of the recovery position if a child is breathing. These skills can be vital in helping a child in an emergency. So let's dive right in. Conduct a primary survey. That's right, we need to perform a primary survey. Can you remember how to do this? We again follow Dr. AB, except notice we have not said Dr. ABC. This is because when we listen for breathing, the child is breathing, so we do not need to begin CPR. How can we help a child? Conduct the primary survey. When you have assessed that they are breathing, you can begin to put them into the recovery position. Remain knelt by the child and straighten their legs. If they are wearing glasses or they have bulky items in their pockets, remove them. Remove and loosen any scarves, don't forget that. Place the arm that is nearest to you at a right angle to their body, with their elbow bent and their palms facing upwards. You could now put the glasses in that hand. Bring the other arm across their chest and place the back of their hand against their cheek nearest to you and hold it there. And then with your other hand, pull their far knee up so that their foot is flat on the floor. Keeping the back of the child's hand pressed against their cheek, pull on the far leg and roll the child onto their side. Then adjust the top leg so it is bent at a right angle and gently tilt the children's head back and lift their chin to ensure their airway stays open and no vomit goes back into their lungs. Adjust their hand onto their cheek to keep their airway open and to keep them comfortable. And call 999 for emergency help if it hasn't already been done. Again, ask somebody else to do this for you if possible, but tell them to say the child is not conscious, but they are breathing. Or of course, use your own phone, having the phone been put on loudspeaker, or using your other devices like Alexa or Google. Then you need to monitor their breathing. Every single minute, you need to repeat the 10-second breathing check. So take your ear down to their mouth and listen again for 10 seconds. If you think that they are not breathing, put one hand on the shoulder, one hand on the hip, roll them backwards, check their breathing, and promptly begin CPR if needed. How can we help a baby? We need to follow our primary survey, Dr. AB. So danger, checking for danger. Response, remember we can talk to a baby or make a loud noise like a clap. You could pinch their earlobes or rub the bottom of their foot because babies don't like that. Try to get a response that way. Then clear the airway. Take the baby's head to neutral and then with one finger, tilt the head up slightly, do not go to a full tilt, and take your ear down and listen for breathing for 10 seconds, again watching their body. And if we hear normal breathing, then we can hold the baby in the recovery position. Take the baby's head in one hand and support the body by holding the baby's body. Use your hand that is holding the baby's head to keep the airway open by maintaining a slight tilt of the chin. Then make sure the baby's bottom is higher than their head. You will need to call for emergency services, ask for an ambulance, and say that the baby is breathing but not conscious. Understanding how to assess consciousness and breathing in children is crucial in an emergency situation, and your knowledge and your actions, they can make a significant difference, sometimes between life and death. Thank you for watching, and please click on the episode below to continue your educational journey.